Well, we are here at the Center for Vein Restoration with Dr. Barajas talking all things veins. So we thought, what better way to talk about it than to show you. So again, thanks for having us in. Thanks for showing us exactly how this works. So I'm a patient coming in. I have spider veins on my legs. I know other people have varicose veins, but walk me through the process and show me exactly how this works.
Certainly. So we use an ultrasound to assess the vein, their function, make sure we don't see any clots.
Okay.
Look for varicose veins, and assess the flow pattern of these veins that are causing patient-like symptoms.
So much that you can find out with this machine right here.
Yes, absolutely.
That's incredible. Okay, so how do we get started?
Well, I'll just have you lay back a little bit here, and we'll just look at the leg portion here.
Okay.
You can turn it out just like that.
There you go.
We need some gel so I can see.
Oh, so it allows you to see even further.
Yes.
Interesting. And we've talked in other segments, doctor, while you're doing that. The big question is, why do I have these veins? Where do they come from?
Well, it's multifactorial. Genetics we know is a factor. Getting older, pregnancies, stand-up jobs, all those influence whether or not you get vein disease.
Right.
And so here, your veins look pretty normal here, normal size in the calf area here. That's called the saphenous vein.
Okay.
About 60% of vein disease is coming from this guy here in patients with varicose vein disease. But you don't really have much of any varicose veins coming out.
Okay.
Back here.
I know, I see a few down there.
These are the
see,
veins you're seeing in the
that.
back. So the green ones you're seeing are here.
Yes.
And they're not terribly dilated, probably not quite varicose vein yet, but over the years they may be.
Oh no.
And
so that's something you do. It's good to know so you can look out for this later down the road.
That's right, and we can address it before it gets worse in many cases.
Yeah.
And then we track the veins to see where they're coming and going, because that'll dictate what I need to do to get the best outcome for patients.
Do you have a lot of patients who perhaps don't realize the difficulties or that it can cause down the road, like with blood clots and other things? They just kind of dismiss it and think, no, it's fine, but it can be a medical problem.
That's correct. In fact, we think about 85% of people with vein disease is a superficial system problem, where the blood is refluxing or pooling. About 15% actually have clots, and those are can be life-threatening.
Right.
And so, unfortunately, they both present in the same way with the same symptoms. So when we scan them, we make sure that we don't have any issues there, and we begin treatment.
Right. Now, we've seen some pictures, I know, varicose veins. They look a little different. Would you call this one right here a spider vein?
So this is a spider vein here, and this may be a dilated spider or a reticular vein, which is just maybe 1 millimeter in diameter or so. But yes, you can have clusters of spider veins here. Women typically can get them on the side of the thigh. It's a very common place.
I mean, I'm pretty open about it. When I was pregnant, especially with my little boy, I noticed and so many of them have gone away, but it was difficult because I think as women, that is a self-confidence issue, right? It's a little more cosmetic, but being pregnant, that really allows them to show up then.
Yes, they can be really pronounced, not just spider veins, but they can get varicose veins.
Yeah.
And we usually like to wait at least 6 weeks. I prefer at least 2 months before I do anything, because many of them do regress.
Okay.
But after so many pregnancies, then they don't go away, and then we can treat them.
Absolutely. In general, how do a lot of your patients feel, right, after they get a procedure done? I'm sure medically they feel better, but it looks better too, right? And if you look better, you feel better?
Right. So we try to give the full package treatment, not just make the legs feel better, but also look better as well.
Right. I want to see one more scan if that's, are we able to put a little bit of gel right over here and just to see what that might look like? Just as we wrap this up, it's really interesting to me it really just shows you what you need to look for, what might be hidden perhaps to that naked eye.
Right. So these small veins are the ones that are feeding into this guy here. So really not too much. They're very small in diameter.
Okay, that's good to know. Is there a tipping point, doctor, if somebody's watching this at home thinking, okay, when should I be worried? When should I give them a call? Or when do I just kind of let it be, right?
So it's really based on both the quality of life and the leg symptoms. So if a patient is concerned quite a bit about cosmesis, and they can't wear shorts, and it just bothers them a lot, that's enough indication.
Okay.
If a patient is developing symptoms of heaviness, achiness, swelling, restless sleep, night cramps, then they can see us for sure, and
Right.
we can see if it's a vein issue.
And I say give them a call too, because a lot of this is covered by insurance. Now, if it's just purely cosmetic, that might be a little different, but call these guys because they're able to answer all of your questions. Thank you so
Yeah.
much.
Thank
I
you.
appreciate your time. You guys, we will put all the information that you need to know about your legs and the veins in your legs as well on IndieStyle.tv.